Hey, what's up guys? It's Confessions of a Doctorholic with Dr. Slayman. Let me tell you guys why I decided to go back to medicine. After everything in my life literally changed. After Dad passed away, I had another serious event happen to my family. We're in the car, Mum grabbed something from her left. Just to paint the picture, my brother's in the driver's seat, I'm sitting in the back in the middle. My mum suddenly tells us that something's wrong. She stops talking. She starts blinking rapidly. It's a bit of a weird reaction. It's like everything stops. She has her hands out and she's like, something's not right. I can't see with my right eye. And I'm like, what do you mean? Like, what do you mean you can't see? And I'm freaking out a little, I'm not gonna lie to you. She keeps closing her right eye with her hand and then opening it up again. And she's like, something is wrong. I asked her to turn back and I'm like sitting in the middle between my brother and her right now. I've got my flashlight on my phone and I'm flashing it in Mum's eye. I'm trying to see if there's like a pinpoint pupil or like anything like that was lodged in there. It didn't make sense, but I was like, maybe. I don't know. I don't know what I was looking for, to be honest, but it was just that I was thinking it's unilateral. So it's like one side, there's no pain, there's vision loss. That's not a good sign. And I'm literally thinking of all the differentials. I'm like, is it giant cell arteritis or is it a stroke? It's just a medical emergency. And then my mum goes to sleep. And this is like the weirdest thing that's ever happened because this is not a place where Mum would sleep. And there was like a soft snore in the background. So my brother and we look at each other and it's like, I'm literally like, it's so loud outside. There's some music playing in the background from a nearby supermarket. And I'm like, there is absolutely no way my mum, who's typically a light sleeper, that she would sleep in such a condition. There's no way. And it was so much because that happened a week after Dad passed away. So here I am, I'm overreacting, I'm worried, I don't know, I don't know if I should trust my clinical judgment or not. A minute passes by and I'm like, okay, I'm calling the ambo, she's not responsive, and I tell my brother to drive to the nearest hospital. So we're in the car driving and I'm literally just monitoring my mum's vital signs with whatever I could do. So I had my finger on her hand, I was checking the pulse, I was checking her rest rate, and it seemed stable. I'm thinking like, what if she had like an irregular pulse, so atrial fibrillation, and that wasn't the case. And then I'm looking at her sitting in the car, and when you expect someone sitting in the car, you see them with their knees like sort of bent, and they're sitting in a comfortable position. Now in this case, my mum's left leg was like kind of stretched out, and her left arm was like bent or like turned inwards. And this is like a classic like stroke position. I couldn't see anything on her face. And now I start testing her neurological signs. I'm like, this is not right. This is like completely not right. She's not responding to me. I keep telling her, mum, mum, mum. And I'm like trying not to cry. I've got like some tears welling up in my eyes and I'm trying to be strong for myself. I'm trying to be strong for my brother. I'm telling myself that having an extreme reaction is not going to help with this situation right now. I need to do what's best for her. So she's not responding. She's not able to squeeze my hand or anything like that. I call the ambo. I'm telling them. I literally tell them my mum's history really quickly. I tell them she's GCS of 11, and GCS is basically this scale where we check if a person is responding to pain, if they're verbal, so if they can speak to you, if they're alert, things like that. And like, so you're kind of involving the sight, you're involving motor signs into this judgment. She wasn't, so GCS 8 is the one where we worry and we have to intubate someone. So she's GCS 11, which is concerning when she was a GCS of 15 prior to that. So it's been decreasing, but it's not like a dead emergency. The ambulance has to be there. So we're stuck in a traffic jam for like 30 minutes and I'm just trying to be calm. There's literally nothing I can do about this traffic jam. So I continue to check And then she suddenly responds and she's like, pain, right. And basically the left side of her body is not moving. Now the right side of her face is drooping and she's pointing to her right arm. And I'm trying to speak to her and she's mumbling. I can't really understand what she's saying. And it's just, now it's just a stroke. Like, I know that my mum's going through a stroke and I'm freaking out. But once again, I'm trying to calm myself down. So we finally get to the hospital. The guys are from the AMBO. They just directed me and they said, that's the right hospital to go to. They've got a huge stroke unit. And they said, you guys should have waited. But then I was like, well, we're in the car anyway. There's a traffic jam. I didn't want to delay the treatment further. I'm in the hospital now and I literally run inside and I'm fit enough to run, but like, it's a different kind of run, I suppose. Don't know how to describe it to you guys, but it's like, I guess it was out of desperation. I run inside and I'm just screaming. I'm not even joking. I'm screaming for help. And I'm like, help, my mom's going through a stroke. And then they're like, where is she? I'm like, she's in the car. So they direct me to the AMBO entrance. My brother drives in there. I'm running in there again. I get a wheelchair out. I'm stabilizing it and we're trying to carry my mum out. I'm struggling. So my brother comes and like, mum's still mumbling and she's like, don't worry. I'm going to come out. I can walk. And I'm like, Mum, you can't. But it kind of seemed like she wasn't all there. Now my brother notices that the right side of mum's face is drooping down. I look into her eye and it's like a down and out pupil. So that's associated with cranial nerve 3 palsy. And here I am and I'm like, oh my God, like I'm seeing this. And I felt so powerless. Like I understand the next steps, but it was too much happening at one time. My brother and I managed to finagle her into this wheelchair. I run inside, I hand over to the team, and basically that involves me just saying exactly what happened, what time passed. So by that stage it was 30 minutes. And I'm telling them my mum's medical history, I'm telling them what happened, and they're like, okay, she's got a stroke. Now the entire medical team is on her. They're trying to cannulate her, so like insert a cannula into her so that they can give her some fluids. They're checking her signs. Now, like, she's slightly, like, reviving. She started understanding what they're saying. They're like, okay, so, like, can you lift both hands up? And she's trying, and she's moving the right side of her body, but she's not moving her left. It was heartbreaking, to be honest, to see that. And, like, now Mum's like to me, I guess she didn't realize that she was in the hospital. She's like to me, oh, tell your brother he can buy whatever he wants. Tell him he can eat whatever he wants. She's still in that first place where we were at in the car. She has no awareness that we're at the hospital. And she's like, what are they putting inside me? Because she's feeling the cannula now. And I'm like, don't worry, Mum. I'm like, right here. I'm right next to you. Then they take her into the CT machine. And basically they use that to see what has happened in her head. Is it a bleeder or is it a blockage? So if it's a bleeder, what they do is neurosurgery gets involved to drain out the blood. If it's a blockage, then they give you medication that can dissolve it so that you can return to function. So they found out that Mum didn't have a bleeder, and by that stage, Mum's sitting there and she's like to me, why are you overreacting? Where am I? The neurologist comes with her student and they perform like the neurology exam again. And she tells him, she's like, look, she's not Babinski positive anymore. And that's literally when Mum realized, when she said that, she was like, I was Babinski positive. I had a stroke. So the Babinski sign is basically a sign that is positive in children. And basically, if you get a pen and you put it on the outside of like the underside of the foot, this is such an awkward explanation, isn't it? Basically, if you do that, it's quite ticklish and you shouldn't be fanning your toes out. If you do, that's Babinski positive. It is positive in children, like literally like newborn kids, and then it's negative for the rest of your life. So now my mum's okay. And they keep asking her some questions again, like, where do you think you are? They're trying to figure out if she's confused, if she's not, what happened. Her CT scan was clear, so they thought it was a TIA. And in that moment, the neurologist, like after all of this is done, she comes to me and she's like, what are you? Like, are you a physician? Are you a medical student? And I was like, yeah, I'm an intern. And it was so satisfying because she told me that I did really well. She said I handed over really well, and that helped them to get to treating mum very quickly. Because basically, if someone does have a stroke, they can give the medication to dissolve a clot in 4.5 hours. So you need to act quite fast. And my brother turns around and looks at me and he's like, I'm really proud of you. My brother's 20, by the way, so he doesn't really know much about medicine. This is not something at all that he's interested in. But he looks at me and he's like, I'm really proud you did so well. And I realized in that moment, I need to come back because I have it in me. I can help people. And I feel so grateful that I could help my mum. And I want to help more people. And just as a follow-up, in case anyone's curious about this, we went for some outpatient follow-up appointments to figure out what happened to my mum, because she's completely healthy and now she's completely fine. She's completely returned to her normal function. Basically, when she turned her head really quickly, that squeezed her vertebral arteries. These are arteries at the back of her neck. And that's why she passed out. And then in the car, when her head was in a straightened position, that returned the blood flow. And that's why she didn't lose function. Everything went back to normal.